Freddy Leckham here. If you don't know me, the reason I want to work with dentists and the reason I want to help dental practices, dental offices work with more patients is because my best friend, Collier, he had his life changed when he basically got his braces done and some other treatments for his teeth. He became a lot more confident, and honestly, since that year, it was ages ago, but since that year, his life just completely changed for the better. At school, he became more confident, his relationships improved, and seeing how his life changed, I want to make sure that dentists are able to work with as many patients as possible, they're able to help as many people as possible, because I'm sure there are colliers out there that need that boost, that need their life to be shifted just because it came from the teeth. His teeth were horrible, by the way. I'm really glad he got them done. But anyways, I wanted to make this video to kind of talk about the hybrid system for dental offices, for dental practices. Yep, you can see that. I'll write a little bigger from now on, but the hybrid system. So the whole point of the hybrid system is to make sure that you are both remote and I'm going to say in person because I can't remember the word off the top of my head. But this is the hybrid system in business in general, right? You are both remote and you have an office, you're in person, okay? But how this works for dental offices, and I'm going to break it down and I'm going to show you exactly what parts should be remote and what parts should be in person. I mean, the in-person parts can be really obvious, but the remote is going to be, I think it's going to change the way you run your office, to be honest, and it should do, because here are the benefits. Right, if I get something to rub off my board, I'll use my glasses wipe as well, but if you look at the benefits of the hybrid system, I'm going to rub off the in-person part first. The benefits are, okay, really simple, to be honest. Not only does it allow you to take on more patients, in the sense that your GDP, General Dental Practitioner, for those outside the UK, your GDP has more free time, so free time is plus. Okay, so more free time, this means more treatments done. That's the main part, right? But also, on the more patients, there's also more team members, and that might seem like a headache, but it really isn't going to be that bad in the sense that the more team members you have, it's not necessarily the more people you're paying, it's the more capacity you have to, one, be able to work with more patients and to be able to support those patients, but also to be able to fix any issues and support other team members, right? The bigger the team you have and the more expertise that they have, the more they'll be able to support each other. And then finally, from all of this, it also decreases costs of working hours. Now this is a part I think is awesome, because not only do I believe that dentists work a lot, and a lot of the time they don't actually take the deserved breaks. I know multiple dentists, and this isn't rare at all in the industry, that just work into their lunch hours. They need breaks, right? They need time to do their own thing outside of work, but also during work they need to take a break. So this is the benefits of it. I don't want to rub it out just because this is terrible apparently at rubbing it out. So I'm not going to rub anything out, but this is quite important anyways. The in-person section I was going to have is quite obvious, right? The parts that you're going to be doing in person are the treatments. They're going to be some of the consultations, which you can also do remotely, but it's going to be the treatments, consultations, and the actual visit, right? Quite obvious. But the parts that are remote are appointment booking, and then you've also got consultations, you've got customer support, and finally you have automated, what's the word? Not responses. I'm going to put responses, but it's automated responses, and this is on reviews plus online online presence. That's it. Plus online presence. Okay, so on the first part, appointment booking. So this is probably the most obvious ones out of all of them, because the consultations can be quite hard to do online. But if I move this slightly so you can also see me, even though you probably might not want to necessarily see me, but the appointment booking is really outside of working hours, right? All of this is built on a system of VAs, virtual assistants, virtual assistants. Okay, so the point of these virtual assistants is that they don't necessarily come into the office. You don't have to keep the office open longer. You don't have to give them any necessary resources. You just have to give them a system operating process. That way they know how to operate certain systems for the appointment booking, they know how to operate consultations, they know how to support customers, etc. And all of this, I'm going to make a really detailed video, so you should definitely subscribe for that, because it's going to be a very long video on how to build virtual assistant support systems and how to build them, SOPs, system operating processes, to make sure that everything is run smoothly and that you don't have to stress about it. But everything here is built on VAs. Now, it might be a deterrent for some people because they believe that everything should be kept in-house, and having people from the outside work with you, it's just going to cause you more headaches, etc. But it works fantastically, and a lot of the big dental offices have virtual assistants for different things. And the point of you working, for example, with a advertising agency is to not have it in-house, to have experts do it. The point of you bringing in dentists for specific treatments, right? Let's say for endo, right? Endo treatments, then you're wanting someone that specializes in endo. You've never necessarily worked with them, you've hired them. You risk them not being as good as you want them to be, but that's the case with hiring in anything. And you got that person from the outside, and it's the same with associate dentists. The associate dentists aren't always working with you. So people being skeptical of VAs, I don't want to say it's silly because I understand where it's rooted, but that there's no point in being skeptical as long as you have good SOPs, system operating processes, sorry. So the part of the appointment booking, what they're going to need is they're going to need to know availability, and they're going to have a number to be called on. That's it. Outside of working hours, let's say it's 6:30 p.m. I ring a dental office. I expect them not to necessarily pick up because I know that's outside of working hours, but for whatever reason, I decide to call them then. And the thing is as well, you can advertise that you're open for these hours, so that way people can call you and you're available for them. But let's say 6:30 p.m, I call. The VA receptionist, as I would call them, picks up. I ask them, hey, I would like to book with Dr. Smith, and I'd like to see Anita as well for my hygienist. And they say, okay, well, Anita's going to be available in 2 months, if that's okay. We're quite fully booked on hygienist appointments. And I'm like, oh, okay, that's fine. I don't mind seeing Anita later on. What about Dr. Smith? And they'll say, Dr. Smith's available next week if you just want to have a checkup. Perfect. They've got the availability. I've got the number to call them on. Bam. Once you break it down, it's not that stressful. All they need is to be able to book them an appointment, and they need to be contacted That's it. They don't have to have access to all your systems, your process. They don't have to have access to everything that your receptionists do. They just need to know when they can book people in and how to book people in, and they need to be contacted. So for consultations, this one isn't necessarily going to be a VA. This is mostly going to be a remote therapist slash hygiene. I'm going to write it like that just so I have more space, but a remote therapist and hygienist, what they're going to be doing is pre-treatment consultations to save the dentist some time, right? So they might have a half an hour consultation to see exactly what treatment needs to be done, and they are, doing consultation. They are helping diagnose the patient on what issue they might have, and they should have enough information, from asking questions and understanding what needs to be done for the patient, to then send it to the doctor and send the notes to the patient and to the dentist and be like, okay, Mr. Smith, by the way, Freddy called. I just had a consultation with him. He's looking to have his root canal sorted. At my age, I hope I'm not having root canal problems, but root canal sorted. X, Y, and Z was stated. This is what I think you should, do for the treatment. Do a 10-minute checkup and ask it, beforehand as well. What this has done is saved a lot of time for the general dentist practitioner, right? For the dentist, it saved him a lot of time, but also it's allowed the consultation to be more thorough, because this is the remote therapist or hygienist's job, right? Of course, it doesn't have to be a therapist or hygienist just because they have quite a lot of expertise in the field and they can come in on certain days, but this is just an example, right? But the point is, having remote consultations really saves quite a lot of time. And in the industry, this is called a full scope therapist or hygienist, is that they're used to the full extent that they should be used in helping out the dentist and helping managing the workload. So I'm going to put these two under the same bracket. Customer support and automated responses. So for customer support, again, they need a number to be contacted on or access to email for anything outside of working hours that needs to be dealt with in terms of customer support, because in recent times, people are demanding a lot more about finances. They're demanding a lot more about, the specific treatments and how they're done. It's more about information than necessarily having a problem with their treatment in the first place. So they might not have had any issues with their fillings. They just want to be aware of, what sort of things they need to do after the fillings, right? One time, well, this was when I was younger, obviously, but I used to think that I wouldn't be able to eat for 12 hours after my fillings. So calling up the dentist really quickly and making sure that I was able to eat after an hour or so, boom, felt a lot better. But customer support, it's just supporting your current customers, it's supporting your current patients, and having that be always available, or at least available within half an hour to an hour of being contacted, it does a lot for just the relationships you have with your patients, right? And then the automated responses and reviews. So I'm just going to put bullet points here. The automated responses and reviews, this is more for just taking the workload off, the office manager, if that's something that they do, or anyone that manages the whole Google side and everything like that. Honestly, it's just to build more of an online presence and be able to support people more online on Google. So if someone were to leave a review, let's say John left a 3-star review. He said the treatment went well. He just said he wasn't very happy with how long it took, for example. Well, the automated response could be, hey John, thank you so much for visiting. We're going to send you a message to learn more about, your experience. That's an automated response, but then that's when the customer support comes in and they can send an email to John asking John what they could have done better, or hey John, we're so sorry that it took so long. for your next treatment, we'll offer you XYZ, right? So the whole point of this whole system, and I'm going to come back and highlight a few bits, is obviously these parts, right? The benefits, more patients, just more patients, right? You're going to have more patients coming in. How? Well, from the simplest one to break down is that the GDP is going to have more time. The dentist is going to have more time. All the dentists are going to have more time to see more patients. More patients equals more money, more revenue. It compounds. More team members, and remember, these team members, if you're looking at the whole finance part, these team members don't have to be paid to work full time because they're not going to be working full time. Nobody is contacting a dentist at 11:30 p.m. That doesn't happen. I'm talking for 3-4 hours after working hours where people might have want to contact customer support, might want to have their appointment book, or might be free after work to have a consultation. This is the point of the virtual assistant system, is to have remote work, more team members who are able to support the entire team. So costs of working hours, there isn't that. They're not they're not doing working hours, right? And especially in a lot of cases where VAs are paid on not on a commission basis, but they're paid for the support that they give and for the time that they save, not necessarily for the hours they work, if that makes sense, because they might not be needed at 6:30 p.m. Nobody might contact them, right? But it's for the consultations that's going to be the main thing utilized by the VAs, right? The remote therapists and hygienists, is because this is going to be a big deal for saving a lot of time for the dentists and to give, honestly, the patients the best experience possible, because it's with that experience of having an in-depth consultation and having their problem fixed as soon as possible without being, in the office, in the chair the entire time, just being in the comfort of their own home, being able to ask the questions they have in mind without being in an environment where they might feel stressed or anxious. And then finally, the customer support section, right? Every patient wants to feel like the dentist is for them and only them. So having your office, your practice be able to support people outside of working hours, not just as I mentioned with booking them in for appointments, but just for general inquiries, that's really, really powerful, right? And the whole reason we need to do this now is because in 5 years' time, the people who started doing this, the people who were available, they're going to have a solid patient base, a loyal patient base. So when they decide to expand, they're going to have a really, really strong foundation to continue building upon, right? Because the number of dental offices we have now is only going to increase in 5 years, okay? Having this support for your whole team with people working remotely is going to just save you so many headaches, and it's going to stop you from being bottlenecked and being fully booked. Even though you're fully booked, you're not making as much money as you want to, you're not working with the patients that you want to work with. It's complicated, right? So this hybrid system of having remote and then in-house, obviously I don't have to go through the in-house part because that's currently what you're doing. This is what's important, right? This is what the future is for dentists, to make sure that they have more time, are helping more people. And this is how the world is going to work with services, with everything. If you're not available for people, you're going to be left in the dust. That's just the reality. That's how it is. That's how things are going. So if you need help setting everything up, because it is very complicated in terms of the moving pieces, but as a whole, it's not that difficult, to be honest. But if you're looking to work with more patients, and this is something that you want done for you as well, we do this for our clients. So we help them set up a system and operating processes to make sure that they're being helped, their team members are facing less stress, and we take on this entire burden and all the risks that come with it. That way they don't have to deal with a single bit of stress. But if you are interested and you can take on more patients, more importantly, then feel free to press the top link in the description. It's not a free guide. It's it's not a free guide. It's not a little course or anything like that. It is a video of me trying to sell you something, explaining what I do and what me and my team do. And if you are interested in working with us directly, then feel free. If not, that's absolutely fine. And to round this up one more time, get more patients by having more time for the dentist, take stress off team members by having more team members to support them, and then decrease the costs of working hours, because figure out, boom, you don't have to stay up, and you don't have to stay an extra 2-3 hours on Saturday. You can just go home and enjoy, because you know that your VAs and remote therapists and hygienists are going to be supporting you, doing the consultations, booking the appointments, so you're not actually missing out on any business. If you like the video, there's a little button that looks a bit like this. Press it, gives me a thumbs up so I know you like the video. Leave a comment if you want any more details on this, or if you want me to do a follow-up video. The other videos in the making, it just takes a very long time to explain the system operating processes. And finally, subscribe. Subscribe if you want to know how to scale your practice and how to work with more patients without necessarily increasing the number of hours you work, and just increasing the quality of your service as well. Thank you so much for watching. I hope you have a lovely day, weekend, rest of the week, whichever one is your situation right now, and take care. Look how grey it is outside. You can't see it very well. Let me take myself off really quickly, but it's horrible. It was lovely recently, but now it's just bad again. But anyways, take care.